Connecticut is in a good place when it comes to the coronavirus. That coming from the nation's top doctor, Anthony Fauci. He was a guest at the governor's daily briefing this afternoon. Channel 3's Matthew Campbell was part of that meeting in Matthew's schools. Of course, big topic today with school starting about a month from now.
Yeah, Dennis, they were. Dr. Fauci touched on everything from elementary schools to colleges, and he's always been in favor of reopening schools, but especially here in Connecticut because our infection rate remains so low. But with that said, Dr. Fauci did acknowledge there will be risks. At 5, we reported that the younger population, those in their teens and 20s, continue to lead the state's infections. And these are some of the people who will be going back to school in less than a month. Dr. Fauci shed some new light on how the virus impacts the younger population. And this information is different from what we initially learned back in March. He cited a Korean study that shows those 10 through 19 years old can transmit infection to adults just as easily as anyone else. He goes on to discuss the impact it's having on those younger than 10.
So you shouldn't be assuming that children are not getting infected. Another recent study showed that when you look at the level of virus in the nasopharynx of children, it's 10 to maybe even multiple more times amount of virus in the nasopharynx of younger children compared to the older children. And if you have that amount of virus in your nasal passage, you need to assume that that child can transmit the virus to someone else.
So parents, teachers who just heard that, they're probably less confident in children returning to schools. But here in Connecticut, Dr. Fauci says there are risks, but you have to trust the numbers in our state.
If the infection rate is so low that there's very little chance of there being infection spread, then you should feel okay about doing it, but making sure that you do the things that are necessary to prevent spread.
And just a reminder, here in Connecticut, our infection rate is less than 1%. If it does get to the 5% or higher range, we could start to see schools close. But when making those decisions, infection rates will be monitored on a county-by-county basis. Live above the newsroom, Matthew Campbell, Channel 3 News.